My name is Caroline McMahon. I'm from Caroline's Angels Baby Sleep Specialists. We recently asked if you had questions on Facebook that you could send them in to us. So today I'm going to look at a couple of those questions that have come into us, and there seem to be quite a few relating to early morning awakening. So I thought I'd start with that one and try and make some sense of why this occurs and what you can do with your baby to have a little bit of a later start. So when we look at early morning awakenings, what we're looking at is babies who persistently wake before 6 o'clock in the morning. For 6 to 7 a.m. is usually quite an age-appropriate time to wake up. Some babies are closer to 6, some are closer to 7. So it really is, a lot of babies are waking at that 4:30, 5 a.m., really quite considered part of the night. So that's the time frame that we're looking at. And there's quite a variety of reasons why this happens. So we'll have a bit of a look and see if you can put this towards some of your babies. So one of our questions was from Anthea, who has a 10.5-month-old baby, who usually has been waking between 6 and 6:30 in the morning, but has more recently been waking at that 4:30 mark in the morning. So what we would look at is that when this happens, often parents will put baby's sleep time back later, thinking, well, they're waking earlier, I'll put them to bed a bit later, and that will shift. Often there's no change, or it in fact backfires, and you see an early morning waking. So have a look at the bedtime that's appropriate for your child. Really, under about 2 years, we're still looking at 7 o'clock. So 2 to 2.5, still 7 o'clock. So if your baby's going to sleep much after that, you might think about bringing their routine forward. So they're actually falling asleep by 7, not starting at 7, but falling asleep by 7. And while it seems a little bit reversed, that's often a very simple way to bring those early mornings forward. The other thing we're looking at is when a baby is going to sleep quite later, they don't sleep as well, they don't get into a deep sleep, and they're irritable and restless. And that's why they can wake that earlier. They've just had enough and they can't keep settling themselves anymore. So the earlier time will certainly help you. What you can also then is set a wake-up time. For many of you, the early waking is there. So what I'd like you to do is set a time where your baby doesn't come out of their room, or if they're in your room, wherever their sleep space is, until a certain time. So you might say, look, 6 o'clock, we'll come out and start the day. So if they're waking at 4:30, 5 o'clock, that you try to settle them, you assist them in some way to go back to sleep. And at 6 o'clock you go, right, blinds up, let's start the day, let's go out and get on with our day, so that they're starting to understand that you're trying to put them back to sleep, and that you're getting a consistent time to start the day, rather than getting up at 4:30, then they're going back to sleep at 6 a.m. and really not setting yourself up for a good night the following night. So have a think about putting that set wake-up time in place. The other thing we're looking at is the volume of sleep your child gets in the day. Because they're waking early in the morning, quite often they'll have an extended day sleep, however many sleeps they're on according to their age, but it may be more than they're actually needing. So then when they go to sleep at night, they might be difficult to settle, which pushes their bedtime out later, which we know gives them a more restful sleep and an earlier wake. And the other reason is that if they're getting a greater volume of sleep in the day, they're just not tired. Come 4:30, 5 o'clock, their body just says, I've had enough sleep in the last 24 hours, I'm raring to go, I want to get up and start. So perhaps come back and look at the time that your child is spending asleep in the day. They may well be sitting in suggested age-appropriate times, but perhaps for your individual child, that is just a bit too much for them. So you might need to experiment a little bit with that and see if by shortening their sleeps by 15 or 20 minutes, having them awake by a certain time in the afternoon to allow them to get tired so that they can settle by 7 in the evening, is a way that you can look back rather than just dealing with that early morning waking. Have a look what leads up to that point. Another question came from Shelley, who has a 6.5-month-old baby, who says that her baby settles beautifully through the day, but come evening her baby turns into a bit of a nightmare to settle, and she doesn't understand why there's such a difference. So again, that's quite an individual question, and certainly we offer phone calls, Skype calls and emails that we can address your questions individually, that you can purchase these through our website at carolinesangels.com.au. But what may be happening for Shelley is that her baby is not getting any wind down time. So it's important, and this is an important factor for early morning wakers as well, that wind down time is quite pivotal to babies sleeping well. Whether it's getting them to settle well in the evening or to extend their wake up time in the morning and avoid these early morning wakenings, wind down time is incredibly important. So what that would be is taking your baby into their room about 15 minutes before you want to start settling them to sleep, and just taking them to their sleep space, darkening the room, having a little cuddle and a song, just very quiet play, and just starting to de-stimulate them. They're visual, they're auditory, just starting to calm them down a bit. It's not to get them to sleep, it's just a little bit of quiet time before they go to bed. And then once you start settling, that baby may be far more prepared to actually fall asleep than being highly stimulated out in the living area. You take them in, you put them in their cot, and they can't manage it. Other reasons for that difficulty in the evening may well be that your baby's getting too much sleep, or they're sleeping too late in the day. Maybe they're not getting enough sleep in the day and they're completely overtired by the evening and no longer able to settle themselves. So there's lots of reasons why, but I'd be looking at wind down time in our discussion of early morning wakenings, that can have a double benefit there. We do have an ebook on wind down time that you can purchase off our website, and I'll put a link to that below the video blog if you're interested in finding out a little bit more about that. One thing for early morning wakings is that we often find these babies have night lights in their room. So what we'd like you to be able to do is turn the night lights off. Like, we'd like you to be safe when you're moving around your baby's room at night if you need to attend to them or you're getting up to feed, but not really bright lights, because what happens when your baby stirs, it mimics dawn. And quite often they've stirred and stirred and stirred through the night, and eventually they can't do it anymore and they're confused about when their night and day finishes. So try and have a light source that is outside their room. So if you need to go in and tend to them in the night, that you might leave a toilet light on down in the hallway so that you can clearly, safely move around their room and feed and change the nappies or whatever you need to do with your baby in the night, even if it's just to settle them, but not have the brightness coming from within their room. You may just like to take a little portable light in with you if you need to get up to your baby, that you might just have in your pocket a little press lamp you can easily get from Bunnings or Coles, and they're very cheap to run, but you can use the light as you need it rather than leaving it on in case you need it. Some babies are quite reliant on their night light, and it may take a little while for them to adjust to that, but that would be certainly something that would help with the early morning wakings. Looking around at your baby's environment when they sleep, have a look at what toys are around them, what's picking up their interest and making them want to play in those early hours of the morning. A lot of babies will have one or two comforters, something that's helps them to snuggle and to feel safe in their cot. But toys that make noise, that rattle around and actually are bright and playful is really not a place for them in the cot overnight, because when they've had that quite a lot of sleep by 4 or 5 o'clock in the morning, and they reach out and they find their toy and it squeaks at them or it sparks their interest and they start playing, they're not really in a position to put themselves back to sleep. They're in kind of play mode then. So only keep toys in their cot that are safe, and 1 or 2 soft comfort toys that make no noise and are not large toys or books to spark their interest. Looking at temperature. Coming into winter, often the coldest part of the night is 4 to 5 o'clock in the morning, and babies are getting cold. So it's really hard, particularly I'm based in Perth, so we have a very difficult winter here where the evenings are a little bit warmer and our temperature drops dramatically overnight. Huge shift in temperature. So dressing your baby for the evening, we dress them a lot warmer, but come 4 or 5 o'clock in the morning they're getting cold. So you might need to look at how you can dress your baby for those cooler temperatures and perhaps keep their room a bit cooler in the evening by having a fan circulating or keeping the door open. Perhaps even a window slightly open just to keep the ambient temperature a bit cooler. But dressing them for that time of the morning appropriately really, really important. We suggest babies wearing sleeping bags, that as they get a little bit older, come 3 to 4 months, we like them in a sleeping bag with no blankets, because they're starting to move around their cots a lot more and they won't stay under blankets. So if you're finding your baby's not staying under a blanket, apart from the safety issues involved with that, it could well be that they're getting up from blankets and getting cold. At least with a sleeping bag on, they're taking their night bed clothes with them wherever they go around the cot and trying to keep them a little bit warmer. And the last thing we really want to look at is self-settling. If your baby is not self-settling, they will find it more difficult to go back to sleep in those early hours of the morning. So have a look at what help your babies need to go to sleep and see how you can reduce that over time. And that may well be where some individual help from Caroline's Angels could assist you in working out how to manage that, and very slowly just allow your baby to adapt to less and less help. You don't need to just simply put them in the cot, walk away and let them sort it out for themselves. That's quite a harsh way of doing it, but just make a list of the help your baby needs, what feelings are created when they go to sleep, and work out how you can reduce that. Sometimes just a couple of little reductions can make a huge difference to you. So we're hoping that this video blog on early morning wakenings has certainly given you some tips that you can look at, and perhaps some things around your baby's room, as well as how your baby is settling, in hoping that you get some longer evenings. And of course, if we can be of any further help to you, please don't hesitate to contact us on carolinesangels.com.au. Thank you. See you next time.